crews started wiping down MBTA stations every 4 hours as a way to protect riders from the coronavirus. Crews were wiping down the Charlie card machines as well and other equipment inside the station. Yesterday, state officials announced that high-contact surfaces like handrails, fare gates, and fare vending machines would be cleaned every 4 hours and that trains would be cleaned every 24 hours. The T is also putting up signs and electronic messages encouraging people to just practice good common sense and good personal hygiene. David?
All right, Lisa, thank you. Poor Dr. Mallika. Marshall, you're working overtime these days. We're asking you a lot of questions. And I wanted to ask you, is it true that there may be 2 strains of the coronavirus that are causing infections?
So I found this really interesting. It was researchers in China who say that they've discovered these 2 strains of this new coronavirus, one called L, which they say is more easily passed from person to person and seemed to cause about 70% of those early cases in Wuhan. And then there's another strain called S that caused the rest. Now, they say the more transmissible strain became less prevalent after early January.
Interesting.
But there are other experts that are cautioning, saying, look, these are preliminary reports, this is not hard data, that it's still not clear which, if either of those, causes more severe disease. So we'll have to sort of see over time. But viruses do tend to mutate in order to best survive.
So there's a possibility that we're not getting the worst of the 2.
Possibly.
Possible. That's
right.
what I'm just hoping.
Caution.
Anyway. And there has been some concern that the screening at the airports has not been going quite as well as we first thought.
I mean, this probably isn't a huge surprise to most of us, but, you know, experts at the Harvard T.H. Chan School of Public Health say that traveler screening programs all over the world may miss up to 2/3 of infected travelers entering the U.S., probably because a lot of people who might be infected don't necessarily have a fever or any other symptoms, which means, of course, there could be hundreds of people or more here in the U.S. at this point. That said, while they initially estimated that up to 70% of adults could ultimately become infected by the virus globally, which I know was very alarming to some people, they seem to have downgraded that number to more like 20 to 60%, which still seems like a pretty big range. But again, as we get more data and more information, those numbers are going to change. You know, what we're estimating in terms of fatality rates, all those numbers are going to change, so we just have to be a little patient.
There's just so much information out there right now.
I know, it's too much.
All right, Dr. Mallika, thank you so much.